Welcome, everybody, to this edition of Nurse Converse on Nurse.org. For those of you who don't have the pleasure of knowing me yet, I am Doctora Tina Loarte-Rodriguez, one of the new Nurse Converse hosts that you voted for. So thank you for all your support. I appreciate you. And I am back today with two lovely, inspirational nurse leaders who I am privileged and blessed to know and get to just converse with for a bit with you all. So it's my esteemed privilege and pleasure to introduce Dr. Roberto Román and also Dr. Danielle McCamey. Thank you both for being here. So actually, as we dive into this episode about nurse leaders, I am just, again, in awe of your stories and your journeys. So I'm going to let you, spill the tea about yourselves. Give us, your abridged version of your rise to fame, because, y'all can be out here for like 3 or 4 hours, but we got to keep it, in small sections for right now. So I will let Dr. Danielle McCamey go first with her intro and her story.
Hey, y'all. Danielle McCamey. I am the founder, CEO, president of DMPs of Color. I have a couple of hats. So I'm going to just, I'm an acute care nurse practitioner. My current gig, I serve as the assistant dean for strategic partnerships, which is really dope because I get the opportunity to network and collaborate with different people across the globe to help advance the mission and vision at Johns Hopkins School of Nursing. I'm representing Baltimore, but, by way of Alexandria, Virginia, but really excited to dig into this conversation to talk about leadership and all the things that have contributed to where I am today. So thank you, Dr. Tina, for this opportunity to be here.
No doubt, my sister. Pleasure to have you again. And over to you, Dr. Roberto Román.
Thank you, Dr. Tina, for having us here. It's always a privilege and an honor just to be conversing amongst greatness. With my story, it's one of those, started from the bottom, now we're at the top pieces. So my journey started as an associate degree nurse, in Miami. Wasn't sure what I wanted to do. Wasn't sure where I was going to go. And if you asked me then if I would be here, I'd probably laugh at you. Because I didn't envision this for myself. But when you surround yourself with mentors that really can help you, I went through my bachelor's, my master's in nursing education at University of Miami, and then my doctorate in nursing practice at Johns Hopkins. So really, fun journey. And then unknowingly or not necessarily planned, just finished my PhD last year at University of Miami. So talking about double doctorate. Really did help get me to where I'm at. So right now I'm serving as the Chief Innovation Officer at Vital Bridge Health, which is a new primary care practice here in Palm Beach County. And I get to help put in my research focus of LGBT inclusive healthcare. And I also serve as the Senior Vice President over academics at International College of Health Sciences here in Palm Beach County in Florida.
Amazing. Thank you. Thank you both for that. And it's just so interesting how nursing allows us that flexibility to pivot and to explore, our strengths, our opportunities, and be like, yeah, no, that's not for me. So I'm gonna go over here because my skills are transferable.
Yes.
So for all of you navigating and still are saying, I don't know what I want to be when I grow up, it's all good. You can figure it out along the way. And just know that surround yourself with good company and you'll be able to continue to navigate that and figure it out.
Definitely.
Yeah. So I have been reflecting on kind of my nursing journey and my nursing leadership journey. And in it, stop to think about a lot of firsts, right? And as nurses, we kind of remember some of those key firsts, right? Like the first finger stick, if you unfortunately had one, but many of us have our first delivery, right? The first time we see life coming into the world. On the flip side of that, the first time we see death and a patient dying, our first code or our first medical error, these are the realities of our science and our practice. But with that, because nursing is leadership. I really want us to reflect on and think about and share and talk about those first memories, that first memory of when you realized and embraced your power as a nurse leader. So that's kind of where I want us to turn to now. And Dr. Roberto, I'll let you go first for this one.
So, you talk about surrounding ourselves with greatness and having the right people in our journey. I remember starting as a new grad nurse, not even a couple days under my belt. And the hospital I started at, where I also did my clinical as a nursing student, was on the magnet journey. So that my manager is like, hey, you can join the unit practice council. I was like, I don't know nursing. She's like, no, but you come in, we know you, you've been on the student nurse on the unit. Just join the council, and we just need the energy. We need we need people just to give ideas. And she's like, you're coming in with a fresh perspective, right? So she gave me that permission to help, to jump in and be part of a team and not feel like an outsider, which was really empowering. So that was like my first piece of like, I do have a voice and I can make a difference. So I worked in the unit practice council for years, through all the degrees and everything. What was really cool about this, when I got my doctorate from Johns Hopkins, I was able to come back as the nurse scientist for that hospital and actually get to walk across the stage with them getting their magnet accreditation. So that was a really neat circle, but it was just, someone giving me the opportunity to have a voice and to make a difference in healthcare, and see that collaboration at the unit level. And that really kind of was the start of my whole career.
Mm-hmm. Love it. Love it. And again, recognizing that it's critical for others. So for those of you who are listening, ensuring that you're calling in and pulling in, those nursing students and those new nurses in the unit, in the department, in the organization, to kind of feel they have the permission to share and to speak up and to contribute. And then also recognizing that you don't always have to ask for permission either, right? Like we have things, we are highly skilled. We have unique perspectives and experiences. And so, we can, as Dr. Danielle likes to say, we could, wait for our seat at the table or just make our own and get things done. So I love that. I love that. And especially how it's so empowering that you learned early in your nursing career. And so, it's never too late or too early to embrace your power as a nurse leader. All right, Dr. Danielle, when's yours?
So for me, I love how you said, I just, if it ain't there for us, let's just make it. Because that's literally how I came into my leadership blazer or whatever. Was I've always thought differently, and I would always raise my hand and share my thoughts that would offer a different perspective that 9 times out of 10 went against the grain or the systems or the structures. And that led me to be on the outskirts of things, but also gave me opportunity to create. And it wasn't until recently that I started getting people to call me in like, oh, you're thinking outside the box. Like, let's welcome this. So I've always been like fringe, if you will. But I guess just growing up the way that I did, always felt confident and resolute with my perspectives and encouraging others to think differently.
Yeah.
And I didn't realize that that was a large part of characteristics that you need to have in being a leader, because it just wasn't termed that back when I was coming up for me, or I wasn't in these circles that said like, you're a leader, that embraced me. I had to kind of make my own space. And so I've always been that one that identifies or sees gaps. And I'm like, well, this is an opportunity to create something. And so that's literally been my entire career, is identifying gaps and leading the way to close those gaps. And majority of it has just been building communities that literally are creating opportunities for those that have been the most marginalized, racialized, and excluded, whatever that class looks like. And so So that's how my leadership has always been, outside the box. And I've been very comfortable with marching to the beat of my own drum. And it seems to have worked thus far, and having people actually follow me despite the fact they don't see the vision. I'm like, trust me, it's going to come together. So I appreciate that energy that I'm gifted with to inspire those that, though they may not see the vision, that they trust the process of me leading to create these opportunities that I am blessed to see ever since I was, what my mom would say, knee high to a cricket.
I love it. And definitely, kind of can relate to having that gift, that superpower of speaking up, because I, like you, have been very verbal and very vocal since a young age. But for me, what was interesting, and I kind of reflected on this too recently, was that I did a lot of that as early as elementary school, right? Definitely high school. For college, forget it. I was organizing the sit-ins and the protests and the rallies, all that good stuff, making that good trouble. And then as a young professional, I was a teacher before I became a nurse. And then as a new nurse, I was also a wife and then a mom. So I had a lot of other responsibilities and tasks that limited kind of my time and my perspective. The other component of that is that, unfortunately, because of the low numbers of diverse nurses in nursing, particularly Black and Brown, as well as men in nursing, I was the only in nursing school and as a new grad. And so I didn't see nurse leaders who looked like me, nor did I know about organizations that were made for me or dedicated to me. And so I was like out of that world for so long. And I realized at the end of December 2020, remember that year, right? COVID and all the other murders and injustices that were unfortunate, and really triggering and powerful, and kind of bringing me back full circle to like, hey, this is who you are. You forgot about that because there wasn't that in nursing. And thankfully I found that with, at first the National Association of Hispanic Nurses, and then eventually with DNPs of color. And so it's just been really full circle for me now to be able to come back and meld those two passions and those two powers I have together, advocacy, leadership in nursing. And it's been just a really, really great adventure, and what fulfills me and nurtures me. So when I have like these experiences, either, at work or somewhere else, I just turn to my community and be like, yeah, this is what happened. Or I need help with this. Who got me? And it's just great now to be in this community. So definitely I appreciate your vision, Dr. McCamey, because I've been following you for a number of years, and thankfully now I get to collaborate with you on DNPs of color. And I trust your gift and your vision, and with you, to continue up this.
Thank you.
This good trouble.
Yes, lots of good trouble.
Yeah. So actually, along that theme, right? As nurse leaders, with the current environment and priorities, and realities of, both our professional worlds and our personal, just curious if you can highlight one or two kind of things that you're focusing at the moment and what we should be aware of. And also if there's opportunity for us to collaborate and or help. And Dr. Danielle, I'll let you go first for this one.
It's so much going on, because I was speaking to one of my mentors about the current climate with the anti-DEI, and thinking about being a leader of an organization that is creating a space for those that have been historically racialized, marginalized. And what does that look like for us to protect ourselves as an organization so we can continue to be the space that we need to be and to continue to amplify and elevate these voices. And what does that look like? And so one of the key things my mentor was sharing with me, she was like, know the history. We've been here before. So start looking to reach out to organizations that have historically weathered these storms that we are currently seeing, because literally history repeats itself. So bring everybody together because you're good at doing that, and start looking at those strategies that were implemented back then and just dusting them off to see what we can do to apply for today. And so that's what's front of mind, is how can we move strategically as communities and collaborate with others that are doing the same work by having organizations focused on groups like us. And so, but also ensuring that we're inserting ourselves in the conversations, in the political policy environments. How are we supporting our members to be able to speak and advocate in these uncomfortable times, these difficult times, and just being deliberate, intentional, and strategic about how we move as an organization to protect ourselves and folks that are connected to us. So that's front of mind. And the other piece is just balance. How am I nurturing myself and folks that are doing this work with us? How are we reminding ourselves to self-care, which I've transitioned to self-nurture. So finding things that nurture the soul, that give the mind ease, and then just also permission to be human and take a break. So those are my two things: the strategy of how we just navigate and move forward, and then how we take care of ourselves and don't lose our mind or our health in the meantime.
I love it. I love it. And commend you on both of those. And it's so critical that we do know our history. Even though, unfortunately, in nursing as a whole, our history hasn't been really documented. So, for those of you who don't know, there's a new book out there called The Black Angels. Make sure you pick it up, read it, check out the book club that DMPs of Color and a whole bunch of other nursing organizations sponsored to learn more about that history. But then also, I think it's really smart
And your book too.
Oh, yeah, that's right.
Let's go ahead and put that out there.
Thank you, Mother. Yes, Latinas in Nursing, Volume 1, which came out last September, and Volume 2 is in the works because, again, we're here and we are amazing, and our stories deserve to be celebrated and out there. So, Latinas in Nursing is also another great part of our history, but also then knowing the other history of our ancestors, right, and how they have overcome, such even more atrocious and challenging times, and persevered and were resilient and were innovative and were able to allow us the opportunities that we have now. And so we're standing on their shoulders. And it's true, like those lessons can just be dusted off, revamped and, just modernized a little bit and then implemented. So really, really great guidance there, Dr. Danielle. Thank you. Dr. Roberto, how about you?
So one thing that you said, Dr. Danielle, is, work-life balance will never exist. I like to think of it, and I've heard this before told to me, it's a work-life harmony. So you decide where and when you need to have those scales kind of tilt to what works for you, right? So that work-life harmony is always, it's always a challenge, always going after it, trying to make sure that we are filling our cup so we can continue to give back and continue to be the leaders that we are. So that's something that, I struggle with on the daily, trying to balance, everything, because it feels like we're always starting the day behind because you always got emails coming through and all of that. But some of the things that are on the forefront of my plate right now, Vital Bridge Health, we haven't had our grand opening yet. So it's a primary care practice, and we've had a soft opening. The patients we have right now are all referrals. We have about 100 patients at the practice. And I'm not a nurse practitioner, so I'll put that out there. I'm a registered nurse with a PhD in DNP. So I want to make sure there's no confusion. But with that, I serve as an advisor to the providers in the practice. And, when we talk about diversity, equity, and inclusion, unfortunately, we know what's going on in Florida. That's pretty much being stripped away from academia, from just our systems in general, where, we're pretty much erasing all of that and just saying that everyone is the same. And reality is we know that we're not. Our race, our sexual orientation, gender identity, all these components, the intersection of all of this can impact the healthcare that we receive and healthcare that we give.
Right.
So at Vital Bridge, my focus is to create and disrupt healthcare is really what our underlying mission is, but to serve the underinsured, uninsured, marginalized communities of Palm Beach County and create this inclusive space for the LGBT community, because it's really lacking and missing here in Boynton Beach. So, it's my hat on that side is making sure that we're providing that safe environment for everyone. Inclusive healthcare is good healthcare for everyone. And on the as a senior vice president over academics, is ensuring that our students understand what healthcare is about, and that we develop this culture of evidence-based practice and diversity, equity, and inclusion. And, I'm proud to say that our student population is extremely diverse. When we look at the demographics, 75% of our students are from all over the world, US residents, but representing Africa, Asia, India, UK, just you name it, we have students that are speaking all different sorts of languages here. So we really do live up to the International College of Health Sciences name, which I'm proud to serve as one of the leaders to help usher our student population to be the future of nursing. So that's pretty much what's on my plate on both sides. So I'm pretty much like split personality between the primary care practice side of things, the public health side of it, and also the academic side of it, which I can't split myself. I can't pull myself from any one of these. Like, this is just who I am on both sides of it. So I fill my cup with the patient care side and the academic education mentoring side of it. And also being that role model, like you said, Dr. Tina, that we didn't get to see necessarily. Me growing up in Kentucky, North Carolina, didn't really see that until I came to Miami. And then, then I just blended in everywhere. So I had to get reminded that, I am a minority, I am a role model, I am a male nurse in nursing, which, when you get into your day-to-day stuff, you get into your own and you kind of forget those, what can be barriers to how we move forward with things. So I appreciated, those reminders of saying that, you're unique, you're special. Don't forget that, so.
I love it. Yes. And definitely, for our listeners out there who might relate to any of the information you've heard so far, know that you're not alone, right? Like, you might be one of few or the only in a certain program or a school or organization, department, what have you, but we are here, right? There's numbers, and I do encourage you to explore, some of the organizations we mentioned so far, DNPs of Color, the National Association of Hispanic Nurses, because these are the National Black Nursing Association, because these are organizations dedicated to making space and being the voice for those who have felt alone. And that's something that I wish I knew earlier in my nursing career about it, because who knows how, what else I would have gotten into along the way, but definitely knowing that I maybe wouldn't have felt so alone throughout my journey. And Dr. Roberto, I just love how your mission is to disrupt healthcare, right? Like, because I just feel like that is like our common theme, right? We are disruptors, we're innovators. We recognize that there's opportunities because things are missing, and then we just connect and collaborate and network to ensure that we are bringing the right people to that conversation to have the opportunity to offer recommendations and then to mobilize and do things. So I love that. And, as a former vice president of nursing for FQHC here in Connecticut, I wholeheartedly know primary care is where it's at, right? Primary care is population health.
Mm-hmm.
And for those of you who don't know, the US healthcare system spends about $4 trillion, of which only 20% of that is a return on health outcomes. So from a business perspective, the model is just all wrong.
Yep.
And it should be totally, revamped, but that's for another episode. But, the fact that you are dedicated to providing necessary critical services that will have such an impact, right, on underserved and marginalized and trying to be erased now or, outlawed communities. But then also that impact, right? Because it's a ripple.
Yeah.
Like when you treat one person, you're not just treating one person, you're treating that family and that community. And so I really applaud you for the work that you're doing. Amazing. I mean, you guys are just so inspirational. It's just been amazing to chat with you, catch up with you. I also just want to congratulate both of you for, balancing and harmonizing and doing your self-nurturing. One trick I will share with everybody is have like an accountability buddy, right? And I do it to Dr. Danielle all the time. When you
All
going
the time.
away,
She's like, okay, I got this email, but what are you doing to take care of yourself right now? I was like, you right. I'm going to go to bed now.
and then she sent me that picture of, look, I'm in Puerto Rico again.
Yep.
Look, I'm on the beach again. I was like, all right, I'm taking lessons from you. I'm making sure I schedule my PTO too.
Yes.
So, it's important because this work is hard, and in order for us to do it, we have to take care of ourselves. So I highly encourage you guys to put yourself as a priority first and foremost. And then continue to be curious as you navigate being a nurse leader. When you're given permission, take it. If you're not given permission, don't ask for it. Just do it. You're not alone. Continue to connect, network, and definitely looking forward to your feedback. Love to see any comments or recommendations or pearls that you, the listeners, have. So feel free to share that with us. Follow along on Nurse.org for more information. Make sure you check out DMPs of Color. We have our conference coming up in Philly in October. We're looking for sponsors.
Yes.
Give us those coins.
Well, we're going to talk about Vital Bridge is going to sponsor, so we'll have to talk about that.
Hey, there you go.
Baby.
There you go. Latinas in Nursing will also be a sponsor. Woo-hoo.
Yes.
But
Bring them out.
Definitely encourage all of y'all listeners out there to explore, what we've talked about, and to continue to know that you are a nurse leader. In whatever stage you are in your journey, use your skills, use your gift, and continue to do the good work. So thank you, Dr. Roberto. Thank you, Dr. Danielle, for your time. Thank you, listeners. I am Dr. Tina Loarte-Rodriguez, your Nurse Converse host. And for more information, tune into Nurse.org. Take care, y'all.
Thank you. Bye.